Well, in today's health alert, heart disease remains the #1 killer of women in the United States, yet many women still don't know that this is their biggest health threat.
And the warning signs can look different than men's and can be easy to miss. So joining us is our chief health editor, Dr. Nandi. And Doc, why does it hit women so hard?
Yeah, it's really interesting. Right? Heart disease is often thought of as a man's disease, but the reality is this, that heart disease causes, guess what, about 1 in 5 deaths amongst women in the U.S., and it affects women of all ages. And now one big reason it's so dangerous is awareness, right? The CDC found that only about 56% of women realize heart disease is their top health risk. Many women worry about cancer, especially breast cancer, when statistically heart disease is really far more likely to be deadly. Another issue is how symptoms show up, and this is important. For years, women's symptoms were called atypical, quote unquote, but that's misleading. Women are more than half the population, and their symptoms can look different. While men often describe this crushing chest pain, women are 30% less likely to report it. Instead, it may feel like chest discomfort or pain in the neck, jaw, upper back, or arms. They may also have nausea, shortness of breath, dizziness, or fatigue that won't go away. And because that, women often wait longer to seek help. And even then, unfortunately, it's not uncommon to be told that their symptoms have nothing to do with their heart, which is quite unfortunate.
So Life's Essential 8 sounds like a guideline from the American Heart Association. Can you walk us through that?
Absolutely. I like it a lot because what I like about it is that they're great for both women and men. First is eating better, right? So that means focusing on whole foods like fruits, veggies, lean proteins, nuts, seeds, and healthy oils. Second is physical activities. Adults should aim for about 2.5 hours of moderate exercise every week, or 75 minutes or more of intense activity. Third is quitting smoking, super important. Smoking is the leading cause of preventable death and greatly increases the risk of heart disease. And next is sleep. Really important. Adults need 7 to 9 hours of sleep. That's right, Simon, 7 to 9. Poor sleep affects blood pressure, blood sugar, and inflammation, all major risks. And then it's about managing weight, controlling cholesterol, and keeping your blood sugar and blood pressure in check. High blood pressure is especially dangerous for women's heart because it's often underdiagnosed. And so here's my advice, right? Women need to be strong advocates for their health. Bring your questions to your doctor and discuss symptoms, even if you feel like they're vague. If heart disease is a concern, ask about testing and follow-up. I can't tell you how many times my patients have had heart attacks and they thought it was something different. Really? So it's really important. If you suspect it, talk to your doctor, because it could save your life. Because it's not only just the #1 disease, it can kill you even while you're getting the heart attack.
Yeah, it's tough. You got to check yourself out.
100%.
All right, thanks a lot, Doc. Good
My
to see
pleasure,
you.
of course.
If you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or X. We'll be right back.